Liver transplantation is basically required for people who have got liver disease which has progressed to such an extent where there is no cure left with medicines. Once you have liver cirrhosis progresses by stages. When it's at the early stage, the cirrhosis can be managed with medicines, the complications of cirrhosis can be managed with medicines. However, after liver cirrhosis or liver disease reaches a certain stage where there is no longer a role of medical treatment in that, that is a time where we advise that the patient should have a liver transplantation. So not just liver cirrhosis, there are a lot of patients with liver cancer, or there are children with congenital liver problems. Then there are also patients with acute liver failure where the liver just overnight stops working. These patients are also considered to be candidates for liver transplantation. So once we've decided that a patient needs a liver transplantation, now how do we, the patients come to us and ask, doctor, what next? What do we do next? So we tell our patients that the step from the decision to transplantation to the point where you have a transplantation is a step-by-step process. It does not happen overnight, that we tell you that today you need a transplant, tomorrow you have a transplant. The first step is that the patient has to be evaluated whether this patient is fit for a transplant surgery or not. What happens is in liver disease is that liver disease, when it progresses, it becomes a multisystemic involvement. So by evaluation, what we need to see is that are the other organs of this person, of this patient, in place to tolerate such an extensive surgery. By other organs, predominantly we have to check whether there is any problem with the person's kidneys, the heart, the lungs, the brain. So there is a whole group of doctors, about 20-25 specialists from all specialties. They get together, they evaluate the patient, they assess the patient. Then there are other medical social workers, then there are coordinators. So they all assess the patient, they evaluate, and finally we decide whether this patient is suitable and or fit for a liver transplantation or not. So in a living donor liver transplantation, if I simplify it, what happens is that you're basically taking out someone's liver, and in the other operation theatre you're removing part of the donor's liver and you're going to put that part of the liver inside the patient's liver. So there are two operation theatres and two surgical teams that are running simultaneously in a living donor liver transplantation. One is the recipient operation theatre and one is the donor operation theatre. So if we can divide it into parts, the first step of the surgery is to remove the recipient's liver and to remove part of the donor's liver in one operation theatre. The recipient's old liver or the unhealthy liver has been taken out of the recipient's body, and a part of the donor's liver has been removed from the donor's body. Then the next step is to get that liver ready to be put inside the patient's body. Now this is done after the liver is removed outside from the donor's body, and this step is known as backbenching. Backbenching basically means that the surgeon is sitting with the new liver lying on a table in front of him, and he is going to prepare the new liver to be implanted inside the recipient's body. So finally, as a third step of the surgical procedure, the prepared donor liver now is ready to be put inside the patient's body, and this process is known as implantation. This implantation basically is joining the structures of the donor's liver to the structures of the patient's body. So if I can tell you a bit technical detail, so there are basically four major joints that we have to make when we are putting the new liver inside. The first joint is the hepatic veins. The veins are responsible for removing the blood away from the liver. Then the next joint that we make is of the portal vein. The portal vein is the main blood vessel which is responsible to give blood to the new liver. So that is the second joint that we do. The third joint is of the hepatic artery. Artery is again another structure which supplies the new liver. So the third joint is of the hepatic artery, and finally the fourth joint is of the bile ducts. It means the bile ducts of the donor's liver are joined to the bile duct of the recipient. So after completion of the surgery, Once the team is satisfied with the surgery and everything has gone well, the patient and the donor are then shifted to the transplant ICU, which is a dedicated place for care of post-transplant patients. And there these patients are there in the ICU for about 5 to 7 days, and then once they've recovered well enough, they're shifted back to the ward and then ultimately discharged home.